Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, good evening, everyone. This is Dr. Joseph Kanu broadcasting live from Rochester Chiropractic, and it is Wednesday, and we have Dr. Jeff Haddad with us. Welcome to the show, Jeff.
Thank you, Joe. How are you tonight?
Wonderful.
Great.
I'm glad you're here, Jeff.
I'm glad to be here.
Yep, I'd be all by myself if you weren't here.
We can't have that. I'm just glad you keep inviting me back. You know, I must behave enough to, still warrant the invite.
We get great feedback from on the website, Jeff.
Great.
By the way, our website, simpletruthsforhealthyliving.com. You can listen to all the shows, and you can listen to Dr. Jeff's shows. You know, and we do have the search engine now. You can type in whatever topics, from amalgam fillings to TMJ to, whatever health issues you're having.
That's perfect.
Gallbladder, whatever, and it comes up.
That's great.
Isn't that great technology?
A wealth of knowledge.
Yeah. Hey, so we're going to do a prayer. We'll do a scripture reading and prayer from 1 John chapter 5. Faith is victory over the world. Everyone who believes that Jesus is the Christ is begotten by God, and everyone who loves the Father loves also the one begotten by him. In this way, we know that we love the children of God when we love God and obey his commandments. For the love of God is this, that we keep his commands. And his commandments are not burdensome, for whoever is begotten by God conquers the world. And the victory that conquers the world is our faith, because he who is indeed the victor over the world, and that is Jesus Christ, the Son of God. And we show our love to God by serving his children. And that's, Jeff, what you do. And that's what we all need to do, right?
Yeah,
we show our love to God by serving his, and we need to be in better health and strong and vibrant to do this to a great capacity.
I couldn't agree more.
Yeah. So anyways, the last show I thought was great. We covered 3D X-ray.
Yes.
That you got this new 3D.
We covered your 3D X-ray.
Yeah, so we covered mine.
Yeah, I mean, you decided that you needed to test this technology out, and luckily you are in very good health, my friend, and everything looked great. I mean, everything.
It did look. That's God's
and actually,
grace, huh?
If people actually want to see your 3D X-rays, they can go to the homepage of simpletruthsforhealthyliving.com. We have it up there. You can see Dr. Joe up close and personal.
Oh boy! Now, are you going to put it on your website, Rochester Advanced Dentistry?
Well, we have many pictures. I don't want to exploit your pictures. I know you feel a little uncomfortable being out there in the public. So, but no, there is actually a lot of information about this technology, how we use it. I mean, we use it in so many different aspects of dentistry. So yes, RochesterAdvancedDentistry.com. Lots of information about really all the services that we provide.
Yeah.
So
Well, I want to let the listeners know that there's only a couple of these in the state of Michigan. U of M is one of the places.
Yeah.
Dr. Jeff Haddad is another place, and the closest place in the Detroit metro area. And when I found out that you had this and how little X-ray exposure it is,
right.
I had to rush out and have it done just to see if there's any teeth infection hidden, lurking, that doesn't show up right, or sinuses.
Well, we talked, and that was a really cool stat that we talked about last week, that, the number one reason people go to the physician, which I thought was amazing, are sinus infections.
Right.
And that 30%, 1/3 of all sinus infections are actually caused by a tooth infection, an undiagnosed tooth infection. So that's very telling. And you can't see these tooth infections, a lot of them, without this 3D technology. So it's very telling. It gives us a wealth of information that truly allows me to not only do a better job, but allows me to do things that we could not do without it. So it's.
I know you were talking about the dental implants and how precise that is, but then
I mean, we do virtual surgeries literally before we even touch the patient. You know, if you want an invasive, you know, exploratory surgery without the computer, you know, testing, well, have fun with that. But I think most people would choose a virtual planning and very predictable surgery that allows me to do a very conservative, predictable, precise, and less invasive procedure overall, which leads to easier recovery, post-op, and the whole thing. So it just allows me to do a better job, you know, and that in addition to the TMJ treatment that we do.
Right. Have you seen any interesting cases since you had the 3D X-ray?
I'm so glad you asked that, actually, because just in the last week, was it last Thursday or Friday, we actually had a patient, and it was interesting. She saw my partner, Dr. Doolin, and we were at least the second, I think maybe even the third office that she came to. She was having problems with a tooth. Tooth already had a root canal done. And every place she's been to took a normal traditional X-ray, and she was having pain with it, but she kept being told that it looked fine. It looked healthy. She came to us. We took the normal X-ray too. We didn't see anything. I mean, it looked healthy as well. But we said, you know, best way for us to diagnose is let's take a 3D image of this. We took a 3D image of it, and we found that the root canal material was actually going outside of the tooth towards the palate.
Towards the palate.
Joe, it was the most amazing thing ever.
So whoever did this root canal drilled too far.
That's correct.
They didn't have your technology.
And that happens, you know, it happens. But the problem was you couldn't tell this poor woman what was wrong with her until then. She was so thankful. Now, unfortunately,
had she been somewhere else before you?
Yeah, absolutely, right? Yeah. I mean, like I said, 2 or 3 other places.
2 or 3 other places, and she had this pain.
Correct.
And they looked at your X-ray, the basic dental X-ray. It didn't show up.
That's correct. And even when we took the basic X-ray, it didn't show up. That's why here's the nice thing about this technology. We don't just use it for everybody willy-nilly here. I mean, we're not just, you know, scanning everybody. But when it's necessary in a situation like this, it sometimes just opens our eyes to something that really is amazingly obvious with this technology. Now, unfortunately, this poor woman, she did lose the tooth, but she was thrilled that we gave her an answer. And
you found the root cause,
no pun intended, of course, right? And the nice thing is, we you know, the tooth's going to be extracted, and we will place a dental implant there, and we'll use it with the same technology. It'll be perfectly predictable, and the patient's going to be great. You know, so
you don't need to do another scan.
No, not at all. We have
So you found the problem. Now you can do the implant. At least you didn't mess around doing a wasted procedure.
Correct.
Right? I mean, that was not going to give her relief.
You got it. And
time, money, pain.
All that. And unfortunately, that happens
suffering,
a lot and has happened a lot in the past. And this hopefully is going to, you know,
alleviate a lot of that.
Yep. Yeah,
that's awesome.
Yeah,
Jeff.
it's very cool.
Hey, so Jeff, I mean, you know, to me, I know you don't want to get tons of X-rays.
Correct.
You know, but like for me, with spinal X-rays, if you've never had a spinal X-ray, have one. At least you have
a baseline.
Point A, and maybe 10 years later have another. You know, and with this scan, that's why I rushed out to have it, knowing how little exposure it is, and it gives us a baseline.
You got it.
To know if there's anything lurking.
Right.
And even, well, how did my airways look?
You know, actually, and then your airway actually looks amazingly good. I mean, it really does.
I'm just really happy that.
Even though, and you know, I'm glad you brought that up too. Look, you're just.
I want to talk about
so
me,
well.
Jeff.
Well,
I want to talk about my favorite topic. You know what that is? Me.
Wow.
You know.
No. we don't have. I mean, how many shows could we really cover that? I mean, it would take way too long. But you know, speaking of airway, talk about timely. We use this technology also to look at people's airways or lack of airways, because we do a lot of treatment for snoring and sleep apnea. You know, that's one of my passions, and we've talked about it in past shows. Well, this past Sunday, you know, I'm always doing my research, and there is a study that came out that it just blew me away. The title of it is Sleep Apnea is Linked to Cancer in the latest studies. And it is I mean, talk about
now we're talking.
Yeah, I mean, you think about that.
Now you're talking
what
about
I want
a
to do
topic.
before we get into, because some of these
this
stats
is not cosmetics.
No, these
right?
are not. No, this is real.
Now you're
this is stuff that
talking some
you're going to get
serious
excited
stuff
about.
here. Okay.
You got it. We have something that, we've talked about sleep apnea in the past, and for those of you who have maybe
let's talk about that.
Yeah, let's review.
rehash.
What sleep apnea is the literal stopping of breathing, sometimes for several seconds, sometimes several hundred times a night. And it caused by, if you're a snorer, let's back up. If you're snoring, I just want people to know that is a sleep breathing disorder. It's not just something that we just make fun of and ha, you're a snorer. We have an issue. Now, does that mean that you have sleep apnea?
A physical issue.
That's correct. What's happening is an obstructive snoring or sleep apnea issue.
This is not a character flaw or something whatever.
And it's kind of been poked fun at over the years, but it's a serious health concern. And when we go to sleep and your lower jaw falls back, that airway can partially collapse, which can lead to the vibrations and snoring that we're all familiar with. If it completely closes and you have that gasping of air several times and you're trying to breathe, that's your body literally having its oxygen shut off for, like I said, several seconds at a time and sometimes several hundred times a night.
Wow.
Deprivation of oxygen to the brain, to the heart. I mean, this sleep apnea, it's already been proven that it is associated with cardiovascular disease, heart disease, diabetes, and obesity. Okay? We've known that. Now for them to add cancer to the list.
How does obesity fit in? I mean, I know when you have lack of oxygen, you are opening yourselves up to a panacea of pathology.
You got it.
Right?
Yep. Well, obesity is kind of a chicken or the egg type thing. Are you snoring? Do you have a smaller airway because you're obese? A lot of times, yes. And then a lot of people, what they don't realize, and when I tell them that they love it, when you're getting good sleep, your metabolism works a lot better.
Works better.
If you are getting poor sleep, an obese person cannot. They're trying so hard. They're having such a hard time, losing their weight.
Right.
If their sleep isn't good, that's going against them. So the metabolism slows down when you don't have the proper breathing.
I always like to relate oxygen to the space shuttle going up into space. And when you see what is that, it's steam coming off, right? Because it's burning on oxygen. Better than any vitamin on my shelf is, I'll tell my patients, take a deep breath every once in a while, right? Take a and clear your lungs. Let all the air out of your lungs. Get the stale air out. Take a few extra deep breaths. Oxygen.
Yeah.
Oxygen is volatile. It's explosive. It's what propels the space shuttle and these rockets into space. So now it makes sense with the obesity. If you're not getting oxygen, your metabolism isn't burning.
Right.
And you're gonna eat a crumb and gain weight.
That's correct. And it's a frustrating thing.
So then we have the cancer issue too, right?
Which is amazing.
Cancer thrives in what we call anaerobic, right? Lack of oxygen,
right?
And also acid.
Right.
When you have acidic and lack of oxygen, you're going to get cancer.
It's increasing your chances significantly. Yeah. And again, the stats in here are I mean, they're scary. But the way that, and we've talked about this too, the way that we treat this, there's two ways to treat sleep apnea. You either get a CPAP which is a positive air pressure system. People have heard of it. You put them at continuous positive air pressure that's actually driving air into your body and keeping your airway open. It's really the standard of care for sleep apnea. And I have many patients that come to me seeking help, and it's not appropriate for me to help them, and I refer them to a sleep physician that I work very closely with, and they
it's
get put on the CPAP.
You cannot help then.
Well, I can, but the first line of defense would be the CPAP machine. Now, coming back into my arena, if a person cannot use a CPAP, which unfortunately a lot of people can't.
You said there's like a 30%?
30% compliance.
Yeah.
So 70% of the people can't. It's intolerable for them to even use it, but they've got to do something. Or let's say you have a mild to moderate, level of sleep apnea. Maybe the CPAP is maybe overkill to a degree. Well, that's where my arena comes in, and we make appliances that actually keep the airway open. You sleep with them, and instead of you going to sleep and your jaw falling back and either partially or completely closing your airway, our appliance keeps your jaw position open and forward.
Forward
correct.
and
allowing
open.
airflow and getting
So
people.
that's what you can do to help.
That's correct.
I mean, because you wonder, what can a dentist do to stop snoring
Right.
or sleep apnea?
Right. And it's unfortunately
So it's mainly the position of the jaw.
a very precise position. And I want to, I'm glad you brought that up. It's scary, very scary for me, because you can go on the internet and Google, snoring appliance, and you can get them for $10, $50. That is about the worst thing that you can do for yourself. A couple of reasons. One, they're not custom to your body. Okay, I've seen people who have used these appliances that actually get thrown into a jaw pain spiral because they're being forced into a position that their body should not be. Okay?
Should not be.
The one size fits all does not work with this stuff. Okay, but the other thing is, and I know that you appreciate what we do. There's nobody monitoring or measuring if the appliance is working. We do that. When I have somebody come in.
So how do you do that?
Okay, I'm glad you asked. We have people come in, if they've even talked about. In fact, half of our health questionnaires ask some of these very valid questions, finding out if they get good sleep. Have you ever heard of the Epworth scale?
No.
The Epworth scale. All right.
Anybody out there that's heard of that, please call in.
Yeah, please,
Dr. Jeff will do a free 3D scan on you, okay?
Dr. Joe needs a little help on the Epworth scale. The Epworth scale is actually a very simple questionnaire, 7 questions, I believe, that literally ask, on a scale of 0 being never and 3 being always, how often do you doze off while watching TV, doze off while watching or reading a book, doze off while driving. And based on that, your score, it's a very important score. As simple as a test is, it's a very important score that can indicate if you have snoring or sleep apnea issues. It's very, very accurate.
Sure.
Now, that said, when we have those indications, we actually have a monitor that we send home with patients. It's called an apnea link. It will tell us, actually,
Right.
both of us, how much they're snoring. Every time they snore, it could be 2,000 times a night, it could be 500 times a night, it could be even more. And it'll also tell you exactly how many times your breathing is hindered, meaning less oxygen coming in, which is called a hypopnea, or when no oxygen is coming in, which is an apnea. That means that your airway is completely closed off and you wake up gasping for air. And these are scary things.
Yes.
And if any of the things that I'm saying are ringing true for our listeners, please, you need to get either evaluated by your physician, evaluated by your dentist, if they do focus on sleep dentistry. If you'd like to be evaluated by my office, I would be more than happy to take a look at you. It's a very – information is power. I've said that before.
Sure.
You can always call our office at 248-656-2020. And back to the website, because I've put so much information on there, to help people. You can go to RochesterAdvancedDentistry.com and just maybe see if you have a problem. I mean, there's a lot of things to look for when you are maybe concerned or maybe not even aware of some of these, issues.
So what are the concerns? I mean, what are some telltale signs?
Okay, well, snoring obviously is one of them.
We know
If you're snoring,
Okay.
the stats say that you are either right now having sleep apnea issues or will for sure in the future. And the reason is, unfortunately, as we get older, we all put on weight, whether we want to or not. And even if we don't, our muscles lose a lot of their tightness and integrity and everything. We get atrophy of the muscles, and that leads us down that path. Okay? Some other things are just reports of gasping by their significant other.
Gasping.
Waking up and gasping. They don't know they're waking up, but they're literally their body is literally trying to wake himself up so that the breathing starts again.
Wow.
It's a scary, scary thing to see.
And that's going over and over and over.
Right. A large neck. Back to obesity. If you are overweight, the odds of you having a snoring or sleep apnea issue are very, very high. You have
it
that thick,
perpetuates itself. Then,
it does.
Right? And then lack of oxygen slows the metabolism. You gain more weight.
That's correct.
Okay.
And, an overbite. People have a very deep bite where their upper teeth are covering their lower teeth. Again, you think about what that's doing. It's pushing their mandible back, which gives them a smaller airway. Back to your airway.
Yes.
The reason you don't is you don't have a significant overbite, okay? And that's a good thing for you.
I thought I did, too. But
believe me.
Enough about me, I guess.
Oh, come on. You know you wanted to get back on your topic.
Can we talk about me a little longer here, Jeff? No.
Morning headaches are another good one.
Morning headaches.
Because a lot of clenchers, and we've talked about this before, too.
Clenchers and lack of oxygen.
They go hand in hand. Clenching has actually been shown as a defense mechanism to try and open the airway for people to breathe. So if you're waking up with morning headaches, you could very well be clenching in addition to having deprivation of oxygen, which is leading to these headaches.
Now that is a whole new take on what we call bruxism, right?
Correct.
The clenching of your teeth, which I was always told by my old dentist, and the research I read was stress. Oh, there's a lot more because it's stress.
Yeah, I mean,
but now here you're saying it's really a survival mode of
that is what the latest studies show. And
trying to open airway.
You got it. I mean, stress, obviously, we all have stress, and don't get me wrong, stress can be a factor, maybe have you clench a little bit more during those stressful times, but most clenchers are even clenching during the non-stressful time. So it's not, they don't go hand in hand. And even somebody, here's another
really
one.
Great information there.
It's very helpful for people to understand. Another one that I want people to...
morning headaches, Jeff. Wow. I have so many patients that come to me, and that's one of our key, where's your headache? If they have headaches, what part of the head?
Right.
Is it dull, achy, throbbing? When do you get it? Is it from blood sugar? Is it your eyes?
Right.
But I thought TMJ, but I didn't realize sleep apnea. I never considered that to this moment.
See, it's something that
just had compunction where the light bulb just went on. Every
I see
show
the light bulb now. I wish this wasn't radio.
It's glowing.
No,
it's amazing
and
that
I don't
the morning headaches could be a sign of sleep apnea.
Correct. Or like I said, or you said it yourself too, a TMJ issue. TMJ patients, if you've ever been told that you have a TMJ disorder or TMJ issues, you could very well have a sleep apnea issue too, because this is one of my favorite stats. 75% of TMJ patients have sleep apnea. 52% of sleep apnea patients have TMJ patients. There's a big overlap there. And a lot of it has to do with that overbite and a poor bite, putting their jaw back and closing off their airway. So you're on the right track with the TMJ, but the sleep apnea is another area there. So listen, this is serious stuff. I take it very seriously. This is different than breaking a little tooth here.
To the cancer.
Yeah, let's talk about some of the statistics here.
Yes.
I'm going to just read some of this, so bear with me here. 2 new studies have found that people with sleep apnea, a common disorder that causes snoring, fatigue, and dangerous pauses in breathing at night, have a higher risk of cancer. Okay, those with the most severe forms of sleep apnea had a 65% greater risk of developing cancer of any kind. 65%. That is significant.
Yeah.
I mean, like I said, some of these stats just blew me away.
Okay, so and that stat goes the mechanism of action.
Yes.
The mechanism of action is cancer thrives in acidic, low oxygen, right? So if you have sleep apnea, there goes your risk of low metabolism, probably diabetes, right? Is that a link to diabetes?
Absolutely.
Right? And then
heart disease.
Oxygen
being stopped from going to your heart and brain. Everybody, the layman knows that's bad, okay? And having that happen, I mean, the number one killer in the world as far as symptoms and disease go is a heart attack, okay? They believe that in 5 years they will be able to associate 50% of those heart attacks to undiagnosed or untreated sleep apnea.
Sleep apnea.
I mean, you think about that. And now back to your low oxygen thing. This is interesting. This is the most recent studies as far as human go, but they've had other animal studies in the past, okay, that suggested that sleep apnea may play a role in cancer. And what they did, they had mice with tumors. They were placed in low oxygen environments that would simulate the effects of sleep apnea, and their cancers progressed more rapidly. You said it yourself.
Makes sense.
Okay, you didn't even know about that. Look at you. You knew it, but I mean, they've been doing studies on this, and you're right. It thrives in these low oxygen environments. We'll finish up with a couple of these stats here. Researchers found that the more severe a person's breathing problems at night, the greater likelihood of dying from cancer. People with moderate apnea were found to die of cancer at a rate double that of people with disordered breathing at night.
Wow.
While those in the severe category, this is amazing, died at a rate 4.8 times than those of sleep apnea. So 5 times more.
Yeah.
This is significant. And so when I saw this, I mean, I thought it was very timely. And, you know, we've talked about sleep apnea in the past, but this is new. This is new reasons to cover it again.
Unfortunately, we only have a minute left. And there was about 10 things I wanted to get
All right.
Number one, dental insurance. Does that cover any of this sleep apnea, TMJ stuff?
You know what?
Dental insurance cover?
Dental insurance doesn't. And I guess I'm glad you did bring that up. It doesn't. Medical insurance, when it comes to sleep apnea and TMJ, the only person that suffers is the patient, because medical throws it at dental, dental throws it at medical, and the patient suffers. That said, those of you who have medical insurance, my office has become and is becoming experts at finding ways for you as the patient to have coverage through your medical, have as little amount of money out of your pocket as possible. If you have any questions about that, feel free to call the office at 248-656-2020. It's a very tricky thing. It's all about paperwork, and it depends on your insurance, unfortunately. But we are doing our very best to get our patients covered because of how important this is.
I've never heard of a dentist billing your health insurance.
It's important.
That's cool. Hey, so next show, how about giving us some tips on sleep apnea?
Yes.
And remember, Dr. Haddad, you guys have the sleep apnea link machine.
Correct.
That you guys can take home. Take snoring, sleep apnea very, very serious. If any loved one, you know, has breathing or sleep apnea, you need to know these things.
Yeah, it's important. You know, we'll cover, I got a bunch of stuff. Next show, let's devote to wrapping up this topic. And I will. I have some great tips
next week.
Because there's some things that are habits that people are doing out there that's really going against their sleep in general. I'll give you some tips to avoid some of that as well.
Great.
Okay.
All right. Thanks so much for your time, Jeff. God bless you,
having me.
Your family, and your entire practice. And crown your efforts with success. You can listen to these shows on simpletruthsforhealthyliving.com or call Dr. Jeff. 248-656-2020, and he can give you the sleep link machine to take home for free. Okay, to our radio listeners?
Right, yep.
You'll do that? Thank you. All right, God bless you. Remember, in all that you do, eat or drink, do all things to the glory of God. Have a wonderful night. See you tomorrow.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.